The consequences are they are going to find that people are going to be injured and hurt and mentally struggling. The number one priority is that people should be able to go home from their shift well.
Negotiations between Ambulance Tasmania staff and the government have stalled, and industrial action has begun. Joining me for this HACSU vodcast, Simone Haigh, President of the Ambulance Employees Sub-Branch and Junior Vice President of HACSU. Simone has been instrumental in pushing for change around paramedic mental health, including presumptive PTSD laws. What is it like for Ambulance Tasmania staff right now?
Ambulance Tasmania staff are not only frustrated, but they are exhausted. The day, night, and the two 14-hour night shifts are just unsustainable in a modern workforce. Our caseload keeps going up and up every year, and the government keep making these wild promises about we'll put on 27 community paramedics and then the last election, paramedic practitioners, which I don't think they quite understand what the parameters are for that. That is a whole different kettle of fish with a master's program and things like that. For them to become a paramedic practitioner, you need to have 12 months supervised in that sort of environment. And there also needs to be legislation changed around the Poisons Act for prescriptions and things like that. Medicare, like paramedics don't fall under Medicare. So there's all these knock-on effects of things that are continually being promised, but then they'll promise with one hand and then do nothing with the other and say that we're bargaining in good faith, and really they aren't.
So what worries you the most at the moment?
What's worrying me is the psychological impact that this is having on people. They are tired, they are stressed, they want to look after the people of Tasmania, but I worry that they are going above and beyond what they should be doing, and they need to start having a look at themselves and taking care of themselves, because I think paramedics are very giving. Everyone comes into this job to help others, but there's a point where you need to look after yourself, and I think and I'm guilty of this as well. It's very much what I do too. We need to really start looking after ourselves first, and I'm worried that people will start making mistakes, and I'm really worried that someone's going to get hurt or someone's going to be mentally injured just because we aren't properly supported by the government. We need to be open and honest about this, and we also need to realise if we don't look after the people that are working to look after the people of Tasmania, who's going to do that? If we do not support our paramedics, there's going to be no one to respond to our emergencies. It has a knock-on effect, and unfortunately I think that's forgotten. It's this them versus us, playing us against the other emergency services. But I think the number one person who's forgotten here is the patient, and that's why paramedics advocate so hard. That's why we're pushing really hard for the 45-minute transfer of care stuff in the emergency departments. It's because of the patient that's out there. They don't have anyone out there with them looking after them. They've called us because they're in crisis, they're critically ill, cardiac arrest, whatever. People call for everything. But I don't think the government is considering those people. They are the number one priority for the government. Any service the government provides is for the people of Tasmania, and we shouldn't be neglecting one area in particular who is only relatively small compared to the rest of health, but are out there as the stopgap to everything in health.
So when we talk about moral injury, Simone, is that sometimes incurred because at times Ambulance Tasmania staff can't provide the care that they want to?
Yeah, there's actually research out there that when something big happens, so for example, one of the terrorist attacks in London, they call all their staff in because they know they're going to be an increase in patients. But they shut down the tube network. The people who were the most damaged were the people who couldn't get in because of that guilt of not being able to help. And 100% that causes moral injury. It's standing on the ramp knowing that there are people out there that can't get an ambulance. It's that knowing that you know someone's suffering and you can't help, even though otherwise you would be able to. See, I could never be a call taker or a dispatcher in our comm centre, because they do that every day, and they would be sitting there wheeling an ambulance to get to these jobs. And I can only imagine how difficult it is for them when ambulances are ramped or they haven't had a break and something comes in and they can't send anyone. Like, I think the most damage happens to them and what they have to try and manage. But then on top of that is all the paramedics that, you know, it's really hard when you need to look after yourself, but you know that people need you. And we're now at a point that people are just that exhausted, they just call in sick because they just cannot do it. They physically and mentally just cannot face another night shift, or it's really, really tough, and they're just so tired.
Is it broken? That's what I'm hearing. What I'm hearing is the system from so many people is broken. Is that how you would describe it?
It is, yeah. It's been a breaking point for a while, but now it's really starting to hurt because as we've all seen, the amount of drop shifts that we've had statewide. We had 1 week where at one point during the day there was only one intern on for a whole night shift in the north at Launceston. So it's not great, and that's because people are just, there's only so much people can give until they break.
What are the consequences if the government continues to ignore these concerns?
Escalated industrial action. Ideally, we don't want to escalate. We want the government to come and listen and take us seriously for our concerns, because we don't put things in a log of claims just for fun. I think even more importantly, the consequences are they are going to find that people are going to be injured and hurt and mentally struggling. And we don't want that. That's a long-term problem. If people go off with a mental injury, it's very hard to return. And we lose some of our most amazing paramedics and experienced paramedics, even new paramedics who have such a bright future because of mental injury. And that mental injury and stress will change someone's life forever. And that's not a good thing. Like, they can have a very, very difficult life because of the trauma that they've suffered and the triggering that happens all the time. But it just feels like they're not listening. We're not trying to be difficult or change the world. We're just trying to make work safer for paramedics. The number one priority is that people should be able to go home from their shift well.